Good afternoon, Hans, Director of the Regional Office for WHO, Dr. Hans Kluge. Thank you very much for being with us today to talk about NCDs, but in the context of this pandemic. We're using the word chronic diseases here for NCDs, but basically I'll be asking you questions with the wording of NCDs. The first question, Hans, is what is WHO Euro doing in the field of chronic NCDs and their risk factors within your new program of work that I know you have launched recently?
Right. First of all, my great pleasure, Raphael, to be with you and with all the colleagues. So of the 6 WHO regions, we know there are 6 regions in the world. The European region is the most affected by NCDs or chronic diseases. Cardiovascular disease, cancer, chronic respiratory disease, and diabetes, so what we call the 4 biggies, are the leading cause of death and disability in our region. In fact, let's say roughly 80% of the deaths in the region and over 2/3 of the diseases, what we call the morbidity, the disease burden, is in the WHO European region. So it's very, very significant. So these NCDs we know are associated with what we call a cluster of behavioral risk factors, mainly tobacco use, physical inactivity, unhealthy diets, and of course the harmful use of alcohol. Characterized also by what we call metabolic risk factors. Mostly raised blood pressure is still a very big one, not only in the eastern part, across the region. Overweight and obesity, which is also a risk factor for the COVID-19, and raised blood fats. So that's a bit overall. Then we can say that the burden of the NCDs and of the risk factors rest more heavily on the lower socioeconomic groups and on men. And this is quite key, because we're standing in our mandate, leaving no one behind, particularly protecting the poor and the vulnerable. And we see that chronic diseases, NCDs, in fact also COVID-19, is not equal in attacking the people. Why on men is also an issue that needs to be further studied. So that's a bit in a nutshell, Raphael. Just tell me if you want me to go into details.
No, that's perfect. And that fits very nicely the picture in Spain, of course. And it's good to know that the WHO Euro has this logic of inequality, which is on where these interventions rest. As you know, this is in the context of a chair of chronic diseases in the University of Santiago in Galicia in the north of Spain. And they're very worried about the impact this pandemic is having on the diseases that we're discussing. So what is the picture that you make out in Europe in relation to that impact of the pandemic on those diseases?
Right. Throughout the pandemic, in fact, large amounts of data have been gathered, particularly on this issue. Why? Because we want something to assess and to measure that impact of COVID-19 on those living with or at risk of the non-communicable diseases, the NCDs, including risk factor of obesity. And in fact, the impact of the COVID-19 response measures on NCDs is what we call multifaceted. So more than one factor. The physical distancing or the quarantine is a situation of stress which leads to poor management of NCDs, to behavioral risk factors, including unhealthy diet, physical inactivity, tobacco use, and harmful use of alcohol, which we have documented. Further, there's some further evidence which shows that without a proper management, the chronic conditions worsen due to the stressful situation and changes in obviously normal health behavior. In our region, which, as you know very well, Raphael, covers the 53 member states, so it's the pan-European region, approximately 7 out of every 10 countries reported that they had either partial or complete disruption of hypertension services and screening. And more than half reported disruption in terms of diabetes care. And in fact, as with other health service and preventive programs, let's say the postponing the medical appointments and tests have shown a delay to the NCD care. And we're very, very concerned about this. I mean, the closure of healthcare units, of pharmacies, of community services. Also, the reduction of the transport to the health services. All links with a disruption in the continuity of the care for the NCD patient. And we see, for example, in a number of countries that for the next years, the mortality due to breast cancer will increase with 10%, for colorectal cancer with 15%, and that's what I call the unacceptable collateral damage of COVID-19. I mean, these are women who never, Raphael, should have died, as we know. I mean, if the screening and early catching on of curable cancers would have been there. And I call it a serious collateral damage, which we now take into account when advising countries. In March, the lockdown was a shutdown. It means it crunched the virus, but it also crunched the people. Now we become more smart, that we work in a kind of a tiered approach according to the severity of transmission in your community. We go to a higher tier and we pay attention to mental health, gender-based violence, people with NCDs, chronic diseases, that we have to be very well aware of this because the pandemic is still not finished.
So thank you, Hans. Because that disruption is so radical and has never happened before, what does Euro think in relation to how can we phase these diseases back into the picture? How can we compensate for the lack of screening or the lack of attention they have received? What is it that Euro can indicate in relation to how we can bring them back as priorities?
This is definitely a priority in the work here, Raphael. First and foremost, we include it now in our message systematically. Tomorrow, for example, I will have my 2-weekly press briefing. We include that very important message, not to ignore the prevention, management of NCDs, chronic disease. So we put it as a box, number one. Number two, you mentioned yourself, we have the European Program of Work, the Vision for Health and Wellbeing for the next 5 years, United Action for Better Health, with 3 pillars. The third pillar is health and well-being, where we working on a paradigm shift from curative to preventative care. Like, for example, has been done very well in under your able leadership in the Basque Country in Spain, a comprehensive approach. I have established the NCD High-Level Advisory Committee, which for the first time will meet 13 December to look really how do we scale up now? How do we catch up through innovations, including digital innovations, to catch up again? And for this, I'm working together with Professor Chris Murray from IHME on looking how much delay do we have as a region now in moving towards the NCD-related Sustainable Development Goal targets. Because even if the WHO European region was doing not so well on the NCD burden and mortality, we were on track for a number of those targets. So first we have to measure, right? What we can measure, we can change. And I'm going to present that report at the Regional Committee in September next year, together with a roadmap to accelerate NCD prevention and control towards 2030.
Okay, that's fantastic. Hans, since you've become the director of the WHO in the European region, I know there's been a lot of movement, a lot of connections with the European Union and with other parts of the broader Europe that goes beyond the European Union. What additional messages do you have from the European office in relation to this very broad Europe, which has all these challenges now?
Some big lessons, Rafael, that we have learned. As you can imagine, I'm thinking a lot about this, particularly as the pandemic is not over, although we see light at the end of the tunnel with the vaccine and the technology development. So what did we learn? First, everything starts with health. The need for strong health systems, which lead to stronger health based on primary healthcare. As you know, I'm a great advocate for primary healthcare. We saw the countries which in the COVID-19 pandemic really kept out the COVID-19 as far away as possible from the hospitals did in general much better. And with strong health systems, we also mean the health workforce. In fact, a number of health systems which were chronically underfunded for many years were hit much worse because the workforce became already exhausted. That's a pre-occupancy now of WHO Europe to nurture, appreciate, protect our health and health workers and social care workers. That's very important. And of course, the positive thing, because many positive things as well, is that what we tried to do for years in digital health, all of a sudden happened in a couple of months. So we need strong health systems, number one. Number two, because you're rightly so speaking, Rafael, on the pan-European health security scale, the solidarity. We're only going to pull this off if we are standing together. And for those countries which were a little bit wishy-washy on solidarity, I always tell, if the solidarity does not come from the heart, at least it has to come from the brain. Because the EU, I had this discussion with the Commissioner of Neighbourhood, Mr. Oliver Varhely, and we understand each other very well, who indeed now is very concerned, how are they going to get the vaccines? Because the EU is not going to be safe without its neighborhood, the pan-European approach. No one is safe until everyone is safe. And third, something that you and me, Rafael, know for a long time, but I saw still a surprise for many high-level policymakers, is the reciprocal relationship between health and the economy, between life and livelihoods. And that's, as you know very well, that I established the Pan-European Commission on Health and Sustainable Development to rethink priorities in the light of pandemics. And again, I would like to thank you for being one of the 17 high-level commissioners, which is to rethink how did society change since the COVID-19 and what does it mean for investment in health and social care. And the innovation of the Commission is it has mainly non-health people, because this is our chance, our dream chance to put health at the top of the political agenda. But for this, we need commissioners from other sectors, which came to a still to formulate the elevator speech to the heads of state.
Now, I think that initiative that you've launched around Professor Monti's commission, I think is really important at this moment, and I hope we can produce what you expect. Hans, on behalf of the chair of Chronicity in the University of Santiago, I thank you for your comments, and I hope this is just one of the first of a series of connections with you. And thank you for joining this webinar, and we'll keep you posted on the results. Thank you very much.
My great pleasure, Rafael. It's always inspiring for me to interact with the students, with the academic world as well, and you can count on me. Thank you so much.
Thank you. Bye-bye, Hans. Thank you.